Hi, my name is Natalie. I own and operate Emmett Whole Body Relief. I have Ray with me today, and Ray's in a moment just going to do a quick testimonial for some of the benefits he's had from receiving Emmett. I only do Emmett. Sometimes I can end with a gentle relaxation massage at the request of the client. In regards to clothing, you can see that I would normally ask Ray to remove his heavier watch just for some particular moves. And with the denim jeans, Ray's just come straight across from work for another treatment, which we'll do soon. In this case and today, I would normally ask Ray just to dress down to his jocks or boxer shorts. It's just too hard to access the pressure points through the jeans. If you watch Wendy's testimonial, she's wearing more clothing but really light clothing. In the case of the massage table, don't necessarily need the table. It's purely for some of the relaxation moves. Many of the moves are complementary or beneficial, done standing and sitting. So Ray, if you just don't mind standing and just sort of turning around towards the table. What I do with some of the back moves is do some of the positions and some of the leg moves standing, and that weight bearing is excellent. So feel free to take a seat again, Ray. Ray did a count up, and this will be a seventh visit. Yeah. And what were some of the physical conditions you were experiencing
when
before
I
you saw me?
When I first started, I think I came to you, well, we've known each other a while, but my lower back was my biggest problem. My neck, I could hardly turn my neck, and I had some nerve problems down my left leg. Now, the left leg's gone, the neck is much, much better, and my lower back is still there, but it's a lot better than it was.
Yeah. Ray does a lot of sitting with his work. You do travelling sales and hours of driving, because what's your scope? It's from Brisbane to Port Douglas.
And then from there's Rock to Darwin, so yeah. It's a pretty big area.
Yeah, and that's all done driving. You have cars in different locations, renting cars, a lot of sitting, flying and driving. So with Ray, I see Ray very irregular. I might see you sometimes there's a gap of a month or 6 weeks or 2 months would be the most. And the benefits are greater if it's weekly or fortnightly, if the client can't change the cause of the problem. So in Ray's case, he can't change the cause. He needs to earn money, that's what he does, he drives and sits. Whereas other people, I can sometimes fix the problem, and they're very willing to change the cause of the problem and change the habit that's causing it. Unfortunately, that's not the case with Ray. And I think that just that restricted neck turning is just that constant. Your job wouldn't require you to turn your neck very often, and you know the cars.
It's a bit awful.
Yeah, and you develop the habit of just relying on the mirrors and not even. I have many clients who realise that they haven't actually used their neck very much. They've just learned to compensate subconsciously. So excellent. We'll get started on the treatment.